My husband and I are probably a great prototype of what's average in America. We have an average size family, an average size home. We've been married 20 years. We're now grandparents and going through the challenges you have when you reach the 6th decade of life, but we're also having a lot of fun. I didn't realize that a person having an episode would affect a whole family, would affect your relationships with friends, affect your relationships with grandchildren, family members. All of a sudden, there were activities that had to be put on hold indefinitely. My name is Linda, and I have gout.
First time Linda had an attack of gout, we just thought it was some kind of a pain. First, it might be a spider bite or something like that.
I was not familiar with gout above and beyond what you learn in nursing school. My father had it, and I remember how painful it was for him when he would have an episode, but I didn't think much about it until I actually was diagnosed and started to experience some of the significant problems that go with it. The challenges to daily life were horrid. The challenges of trying to manage just moving around in your home, of trying to cook, of trying to go to the grocery store or go anywhere. I really had no understanding that gout could be so debilitating, not just to your joints and your overall health, but to your other organs and body systems as well.
Gout is a disease where too much of uric acid builds up in our body, and uric acid is a byproduct that is produced in our body by our body's just normal metabolism. And if we have too much of it, it can cause problems. We drain it by excreting the uric acid through our kidneys. And this uric acid will eventually crystallize and cause something called uric acid crystals, and they'll go to the joints and deposit there.
When the body's immune system recognizes crystals that are forming in your body, it creates a large inflammatory response that can be very painful and destructive. Gout crystals are being laid down with every gout flare, and those crystals, if they stay near around a joint, can cause irreparable joint damage, and that can lead to disability.
Tophus is a nodule that you can develop under the skin or on the tendon or in the joints. That is basically pure aggregation of uric acid crystals. And people who have a lot of those, we call them tophi, which is the plural term of tophus. So even though they're taking medication to lower the uric acid level in the blood, the tophi will release the uric acid crystal in the bloodstream.
And it can increase your amounts of cytokines, which can lead to increased risk for cardiovascular disease.
Gout is not a subtle disease. It's very acute in onset. So people can just walk normally, and within a matter of hours, they cannot walk anymore because severe pain in the swelling in the inflamed joints.
With my wife Linda's gout, when she has a flare, it comes on suddenly, and usually it's if you bump her leg or her foot or something like this, it causes extreme pain. And so things that you usually would have done before now become difficult, as far as anytime you get close to one another, or even in walking around in the kitchen. If you inadvertently bump into her, then it causes extreme pain.
People who've never had a flare of gout really don't have a clue as how painful it can be. My female patients would say it's worse than delivering a child, and that extreme pain was going on for day in and day out. You don't want to breathe on it, you don't want to sheet on it, you can't move. It's completely debilitating. Lifestyle modifications and diet do play some role in gout. So Most of the gout is caused by kidney problems, and so that needs to have adequate treatment. You can't just have diet alone for most patients.
But now we know that it's not just the food, there are other causes that can trigger gout. Certain diseases such as chronic kidney disease, hypertension, high cholesterol, diabetes, obesity, those are also linked to gout.
I didn't realize all of the risk factors I had, but I had numerous risk factors. I'm a postmenopausal woman. The decreased kidney function predisposed me as well. So in addition to those and my family history, I call it the perfect storm. It wasn't actually until I had had several episodes of gout that I was properly diagnosed and had to face the reality. It wasn't just my diet, it wasn't just my lifestyle, it was a combination of several things that were causing the episodes of gout.
It is very important to diagnose gout early and managing it early because gout can be very aggressive and can destroy the joint. So it is very important if the patient has severe joint swelling and pain, redness and warmth in the joint, it is very important for the patient to see the doctor immediately so that the joint can be examined. And if there's any fluid, the fluid can be drained from the joint, and then the doctor can look with the microscope to look for uric acid crystals in the fluid. And that's how gout is diagnosed.
The first suggestion that it was gout was actually an episode when I was able to go see a podiatrist who's well known to our family. We talked about what we would do to treat it. He gave me some suggestions. It would have been helpful if at the first or the second or the third episode of gout, I would have been appropriately diagnosed. We could have saved a lot of time, a lot of pain, a lot of suffering, a lot of uncomfortable issues that my family and my husband had to deal with had we known and been able to be prepared.
By the time she saw me, she was already diagnosed with gout. So everything was kind of playing together for her. And in the time she developed the joint pain, because so many things going on, I think it was a little bit difficult for her doctor to catch the gout at the time.
Out of control gout, it's something that you would never suspect.
Out of control gout is when you're having multiple flares of gout, or that when you're on adequate therapy, you're still not lowering the uric acid in your blood enough to prevent crystals forming.
So it's really difficult to treat gout. They are different because majority of gout patients will respond to medicines that lower uric acid level, but this patient just do not respond, either because they have underlying causes that prevent the medicine from working, or they have they're taking some medication that is keep increasing the uric acid level, so they're counteracting with each other, or they could have genetic mutation that just cannot keep the uric acid level low.
I did everything I could to learn about it and learn what was available to treat. The same handful of medications that were available, Dr. Lee revised them a little bit and changed a few things to hopefully make it more effective and more tolerable. She was aware of all of my other health problems and the considerations we needed to take.
For her, it's really difficult because of all the other medical problems that she had that is fueling linked into the gout, and the fact that she has side effects to traditional medication.
Oh, it is. No wonder. It's like a bathtub, huh? All done. Very good. I've been able to recover enough activity to enjoy doing the things that are important to me. Today is a beautiful day. It's warm, it's sunny, and it's a great day for us all to be going outside. I do have the fun and the enjoyment that I had missed while I was having gout attacks because I'm able to be with them. I'm able to move more. I'm able to chase after them a bit. We're able to have fun together.
I'm very hopeful for patients who have out-of-control gout. We have therapies that work very well and that we can get them under control and get them back to a normal, happy, healthy life by using urate-lowering therapies, adjusting their lifestyle, adjusting their diet, and having them avoid alcohol and high fructose corn syrup.
We have a lot of research going on to find out how gout is created in the first place and what mechanisms fuel into causing the joint inflammation. Once we know this information, we'll be able to really target the mechanism how the gout is created, and we should be able to treat those patients.
Our future currently is hopeful with the treatment that Linda goes through. We're able to enjoy time together and with our grandkids, where before it was more difficult, especially if the grandkids are rambunctious. It was always trying to keep them from bumping into her leg or her foot or affected joints. And now we don't have that concern.
Hey Patrick, can I sit by you? I was fortunate. I've always had good medical care while going through this. I would recommend anyone that has gout to take it seriously, to do everything you can to manage it and make sure it's treated appropriately.